Microbix, of course, is a specialist in infectious diseases. Our company started um, providing growth media to public health laboratories, culturing different bacterial and viral strains circulating into the community. We then, over the years, moved to actually growing the organisms for the public health labs. And then some years ago, we're invited to actually provide those products to global manufacturers of immunoassays and diagnostic tests. So we're actually a global leader, if not the global leader, in proficiency or so-called serology tests. And we actually provide a whole series of those products. You can see here all the organisms that we culture at industrial scale, culture, purify, and inactivate in industrial scale in our facilities in Mississauga. So it's a very important company from a global public health perspective, what we do, and we have actually a mitt full of letters recently attesting to our being essential to public health on a global basis. That is about 90% of our current sales is to international companies, including for tests for respiratory pathogens, such as flu, adenovirus, parainfluenza, RSV, and different forms of bacterial pneumonia you can see on the respiratory side. And that, of course, is growing in a couple of areas. One is, of course, as modern medical testing has been rolled out more broadly. We're seeing greater use of our product, not just in North America and Europe, but across Asia Pacific regions. And more testing going on, as with COVID-19 happening. It's important that frontline providers are aware not just whether a patient has COVID-19, but if they don't, do they have flu or another circulating virus? And if they do have COVID-19, of course, are they co-infected with another virus that's going to make it even more dangerous for them? We also took that expertise and we have gotten involved a number of years ago in providing what we call CAPs, or quality assessment products. And these are the mimics of actual patient samples. And they are used to help ensure the accuracy of medical tests. And if you're testing on an analyzer, however good, or a manual test or automatic test, you always must ask yourself, is the technician making an error in the operation of the test? Has the instrument gone out of calibration? Have the reagents spoiled? Well, the only way you can safely validate your quality system is effectively bookending a run of tests with a known positive sample and a known negative sample. Doing that at the start of a run of tests and doing that at the end of a run of tests. And that is what enables you to have confidence that the 100 or so tests in the middle are actually giving you valid results. And Microbix has been uniquely positioned to do that, because we know how to grow the organisms, we know how to inactivate them, we can augment them if we need to with leading edge biology tools, we know how to formulate these controls, how to stabilize them, and we have the quality systems to validate all that. And this is something we're not chasing COVID-19. This is a business we've been in for a decade. We have provided and become, in fact, one of the leading providers to test the competency and provide the accreditation of clinical laboratories all over the world. And product sales into this niche had plateaued in recent years due to a lack of new product introductions by Microbix, which is something we have absolutely changed. And we initially went about this by also going into two new categories, not just proficiency, which was white label business. Nobody ever saw Microbix name on those products, those samples that would go out to the labs to certify them. So we created two new product lines. One we call Proceed, and the other we call Red. And Proceed is to develop new tests, to help with the development of panels of tests, and to train technicians and labs on new instrument installations. So, for example, there's a very successful analyzer company called Sekisui out of Japan. No new instrument ships from them unless accompanied by a starter kit of Microbix controls, in order that they can validate the new instrument and know that the technicians are trained. And we're doing this work for a number of companies now, and sales to that category began in 2019. And then in September of 2019, we launched our first products under our Red Controls banner, and these sales are directly to clinical labs. So this is the formal quality control of lab testing where patient outcomes are directly affected. And this first product launches were actually in the category of human molecular testing, or our PCR testing for infection with the high-risk types of human papillomavirus that most people carry. A very significant opportunity for Microbix, as there have been no adequate controls available to ensure the accuracy of this sort of testing. And opportunity moving into a $500 million potential market, which would be about 1/10 that amount for the opportunity for controls. And you can see here on slide 15 that respiratory was considered a smaller niche at that time. Of course, that has all changed. And I say that because it is a tremendous precursor for us to be able to apply all this background of expertise in virology and developing controls for infectious disease tests to be able to react quickly to help the public health emergency around COVID-19. So as this became apparent that this was in fact a pandemic and that human-to-human transmission was happening, our team began to work very intensively to develop a Red control, or a couple of Red controls products for COVID-19. And you can see here, this is a chart from March where global cases were about 550,000, were it only still so. What we have developed are controls for COVID-19 testing, the testing for the SARS-CoV-2 virus, and they will work with anyone's molecular test for the virus, which is very important because labs do not want to have to stock a control that only works with one test or with one instrument. They want to be able to offer quality control for all the instruments that they are calling into use. So very, very important. And we've developed controls on Copan flock swabs, the nasopharyngeal swabs that you see being used on the television. We also have a liquid format swabs, and we're announced that when we completed internal and external validation of the product on March 30th. We then refined with working with multiple international test manufacturers to optimize it for use across everyone's instrument. We filed for Health Canada approval and FDA emergency use access on April 13th. We were granted Health Canada medical device establishment licensing, which permits the use of our controls in Canada, on April 21st. And in between those, we've already set up with a partner in Vancouver called One World Accuracy, a global training program to validate and accredit labs for COVID-19 and other viral respiratory pathogen testing that will involve availability in 60 countries. About 6,000 laboratories potentially will be trained That will roll out in June, that testing program, and we will begin shipping product on or about April 30th in quantity. We have capability to make about 5,000 swabs a week and 10,000 vials, and we've actually received our first Canadian orders today. So very topical for us, and these are great opportunity to help public health globally and to be able to have a great opportunity for our shareholders that leverages our company's core strengths. And we see the Red Controls branded product, fully regulated, innovative, proprietary, rolling out more broadly. And our company's opportunities, as has been discussed with others, are not limited to COVID-19, but certainly this is an opportunity to help public health and employ our skills. I'll just won't dwell on a lot of other things. We also have a great partnering asset, but our company is very much a real company, and we have 80 employees, 24,000 square feet of manufacturing and administrative spaces in Mississauga, and definitely some material opportunities.